Swipe or X.
Don't you worry because we made sure that this event is jam-packed of information. Saturday afternoon into an extraordinary one. I am pretty sure that just like me, you are all very ecstatic to meet our speaker. Learn more about immunology from her presentation. And even the World Health Organization had COVID-19, no, it is us understand and how valuable it is in managing diseases and conditions relative to human immune system. With that, ladies and gentlemen, may I welcome each and to this afternoon's session with the theme developing and delivering medicine vaccines of people around in partnership, of course, with the largest pharmacy network in South Asia, Swipe RX. Ladies and gentlemen, I am Mark Ladidoana, a clinical pharmacist from Dagupan City, Philippines, and I will be your moderator for this afternoon. We present our program proper. I'll just explain to you some house rules that each and every attendees are expected to strictly comply on all throughout the session. We will be muting your microphones while the session is ongoing. You may submit your questions via Zoom question. Follow right after the session, and we will try to attend most questions within the given time. In order to get the certificate, you need to attend the webinar for at least 45 minutes. Let me reiterate that. In order for you to get your certificate, you need to attend these webinars. For the issuance of certificates will be announced at the end of the session, so stick with us. Last but definitely not, please sit back and enjoy. To formally start this event, let's now have our opening prayer. In your guide, we would bless every person who has gathered here today, and that you would be present with us today. That this program, time of learning, growth, and fellowship for all of us. Help us to listen to one another with open hearts and open minds, and to support one another as we strive to serve you in all that we do. Please give us the strength and the courage to follow your will and to use the gifts and talents you have given us to make a positive difference in the world. We pray all of this in your holy name. Amen. All right. We are now down to the highlight of this afternoon's event. I know that you are all very excited to meet our speaker, so without any further ado, our speaker is a diplomat and a fellow of Philippine Academy of Family Physicians with a degree of Master of Science in Clinical Medicine, Family and Community Medicine. Our speaker is an associate professor of University of the Philippines College of Medicine, a consultant of Department of Family and Community Medicine of UPPGH, Manila Doctors Hospital, and Holy Family Hospital in Laguna. Aside from that, she's also a family medicine specialist at Healthway Qualimed Manila, a research coordinator of Manila Doctors Hospital, and a training officer of Department of Family and Community Medicine Residency Training Program of Sorsogon Provincial Hospital. Aside from her exemplar background as a physician, our speaker also gives time to perform leadership function for various organizations. She's part of the Board of Trustees of Philippine Academy of Family Physicians, Board of Director of Family Medicine Educators Incorporated, and a council member of Fragility Fracture Network Philippines. My dear fellow pharmacy professionals, swipers, I present to you Dr. Ana Gia Olimpoco.
Good afternoon, everyone. Thank you, Sir Clark, for that very kind introduction. As you have said a while ago, I will make this afternoon as engaging and as fruitful as possible. And I would like to send my shout out to all 1,700 pharmacists nationwide. Good afternoon po sa ating lahat. So let me share my slide. Okay. All right. So I hope it's clear. Is it?
Yes, Doc, I can see it.
Okay, thanks for acknowledging that. So my talk this afternoon would really be perhaps a review of what we know already. Just a little reinforcement of what we know on immunology, like the basics that we should be able to, share the information with our clients and with our colleagues whenever there are instances that there's need to be there's a need for information dissemination. We need to provide proper guidance in terms of improving health literacy, not just for our clients, but to all of us, particularly in the health professions. So let me start with this one, talking about the COVID-19 pandemic, which highlighted the importance of a strong immune system. So all of us, even in the health professions, our kababayans, biglang na-shift yung kanilang eagerness to put importance in maintaining a strong immune system for not to have COVID-19. And so having said that, the highlight was placed on the immune system boosters at the start of the lockdown. And it's important for us to review immunology and how the immune system fight diseases. Okay, so I have 5 objectives in the next 30 minutes. Number 1 is just to differentiate immunity versus immunology. The second one is to review the types of immunity and describe the mechanisms used by our body to defend itself. And number 4, the different approaches to help boost immune system or immune response. And lastly, the most afternoon is to highlight the role of event management. Okay, so one slide on immunity versus immunology. When we say immunity, it's our body's ability to recognize harmful organisms, be it bacteria, viruses, fungi, and that would prevent us from causing or having illnesses. So we need to mount a very, very good immune response. And when we say immunology, that's the study of immunity. That's the science of immunity. So just reviewing the immune system, our immune system is made up of complex collection of cells and organs, providing protection from pathogens and disruptions of which may result on inflammation or infection. Sometimes the an attack in the absence of pathogen. So just a review of what we have in our bodies. We have our adenoids, lymph nodes, the lining in the small intestine, the Peyer's patches, our bone marrow, our appendix, our thymus gland. All these are part of our immune system. And when we say immunity, there are 2 types. So we have the innate or the non-specific, as they say, born this way. So we have this already. So this is our physical barriers, our chemical barriers, and our inflammatory cells, which immediately responds to harmful agents. And the innate immunity does not require a previous exposure to a foreign substance. In contrast with the active immunity, which is acquired, this consists of our T lymph identifies attacks and reinforces immunity to a specific antigen. So Dalawang klase lang yon, no? Immunity. The innate, what we already have, and the adaptive or the specific acquired immunity. So let's talk about a little on adaptive immunity kasi ito yung nakakalito. Adaptive immunity is divided into two. So we have the active and the passive. So when we say active adaptive immunity, this could be from natural sources, so reinfection, and induced through vaccination. So that's the active adaptive immunity. On the other hand, when we talk about be induced via vaccination or natural through maternal antibody. So pag sinabi nating active immunity, this is where our body produces our antibodies to develop antigens, to respond to antigens, which could be naturally acquired, developed after exposure to antigens in the environment, or induced after the administration of an antigen. On the other hand naman, when we say passive immunity, this is produced by the transfer of antibody. Person may have not so good immune system that would lead to the disease. Either way, the adaptive immunity of the person gets activated, leading towards recovery. And it could be in the memory that when the same infection would come in, it could either mount the same response, could be at a lesser degree or a much more severe degree. Kasi for example, no, yung dengue natin. When you had a dengue infection once, it doesn't mean you are safe from not having dengue again. Because dengue has 4 strains. So pwedeng nag-dengue ka on the first episode, pero the second time that you will have the dengue infection, not from the same strain that you had previously, but from another strain. Pwedeng ganoon, ano? Now, another example, varicella, chickenpox. When you have it once lang yun, ano, your body will develop antibodies to it. Magde-develop ng same presentation of chickenpox because you already have antibodies to fight it. Okay? So, the first line and second line of defenses. So when we say first line of defense, all of us have it, no, yung ating our first line of defense. So our saliva, our tears have antibacterial enzymes. The mucous lining in our organs could trap the dirt and microbes. Our skin, the biggest organ in our body, is our biggest first line barrier to all this infection. It prevents entry. Our stomach acid, because of its acidic, very acidic nature, could kill harmful microbes or bacteria. And of course, our good gut bacteria that always competes out the bad bacteria. That's our first line of defense. The second line of defense are our macrophages, the neutrophils, basophils, eosinophils, dendritic cells. And when the first line of defense bogs down, automatic, ma-activate na yung ating second line of defense. And the third line of defense is, of course, the antibodies that we already have, no? So these antibodies, no, will work once they've detected a similar entry of pathogens that goes into a body of a person. So we have the first, the second, and the third lines. Let's talk about a little on the first line of defense. So the membranes, and we have the chemical barrier. So ito yung saliva, yung tears natin, the stomach acid, and the good. would set in. Swelling, the pain in the area or the infection. That's why when you have fever, oh no, my line of defense is already activated. Ibig sabihin, nag-fail na yung first line of defense ko. Nag-fever na ako. So, my second line of defense is not working. So, the speed of immune system reaction is increased and the growth of temperature is sensitive to try to inhibit the microorganism. Okay? The second line of defense is really the very perfect example of our inflammatory response, no? So the inflammatory response happens when the injured tissue release chemicals called histamines. And these histamines begin the inflammatory response. So it happens when there is capillary widening, increased blood flow, kaya mainit yung part ng body na yon, na may ongoing infection. And then that would cause the redness. And then that would attract leukocytes, site of injury causing tenderness. And that's where the systemic response would be activated already. Mag-fever na yung ating patient. And that would signify pain already. Okay, so that's our second line of defense. All right. I mentioned a while ago that the first and second line of defense are our warriors. And the third line of defense are our assassins. Ano? Sila na yung deep penetration agents natin, DPA, special agents na. And there are two specific immunity. The naturally acquired immune response against daily life and our artificially agad siya. And that would mount an artificially. The second line of tandaan nyo lang, third line of defense, to mount an immune response, to have antibody production. Okay, so antibody production. Okay.
Our immune system provides body defense. When pathogens enter our body, and used to act against the pathogens. Now, to get into the blood. Pathogens have specific markers called antigens on their surfaces. They are substances that stimulate immune responses. When certain lymphocytes called B cells in the blood come into contact with a specific antigen, the B cells are activated. The activated B cells then multiply and differentiate into plasma cells and memory B cells. The plasma cells produce antibodies to act against the pathogens or their toxins.
All right, so that's a very short clip regarding antibody production. Okay, review na lang yan for all of us. Okay, so how do diseases spread? So having reviewed our immune response, the levels of defenses, how do we correlate that with how do diseases spread? So there are mechanisms on how diseases spread. Through direct contact with the tissues or fluids of an infected individual. And this is the most common and the highest risk route of pathogen. The next is fomite transmission. This occurs when inanimate objects contaminated by an infected individual comes into contact with a susceptible animal or person. So ano tong mga example na ito? Ito yung mga examination tables, medical equipments, environmental surfaces. That's why during the COVID-19, part of the safety protocol is really maintaining the cleanliness of the surface areas that we usually work with, no? Because we wanted to inhibit fomite transmission. Another is aerosol or airborne transmission. The pathogens are transferred via tiny particles or droplet nuclei. Example, TB infection, COVID infection. Infected individuals can release aerosol particles into the environment by breathing, coughing, sneezing, or vocalizing. That's why nung COVID-19, di ba, cough etiquette, kailangan nakamask tayo. We even resorted to ma-minimize yung aerosol procedures like yung bronchoscopy, suctioning, no? Kailangan talagang well-maintained siya na hindi aerosol transmission na tinatawag. Okay? Another mechanism is oral ingestion or oral transmission. This occurs when contaminated food or water contaminated. The environmental contamination is mostly commonly due to exudates, feces, saliva. And lastly, the vector-borne transmission. The vectors are living organisms like mosquitoes, rodents, etc. that can transfer pathogenic microorganisms. Example, the rats, di ba? Pag flooded or may mga baha or rainy season, the leptospirosis incidence would rise pa rin, ano, of this. And another example is yung ating round. So these are examples of vector-borne transmission. These are the 5 mechanisms of how diseases could spread. Direct transmission, fomite, aerosol, oral, and vector. And boost our immune system. So we have 5 factors to look into: the diet, the exercise, stress management, infection protection. So again, just review perhaps for part naman talaga kahit usual consultation. Advice on proper diet and nutrition is always included. No prescription ito to boost the immune system to super normal levels because we can eat anything but in moderation. And these are some recommendations: minimally processed, seasonally fresh, locally grown foods, olive oil, abundant plant foods, dairy products, red meat, wine, etc. Kaya lang, the thing there is dapat in moderation. Later, after our discussion, try to check phex.ph and then just put there your weight and height, your age, and it will get you to the recommendations for you regarding nutrition. So yon, it's a big help also. So that's diet and nutrition. This is an example of the Asian food pyramid. Di ko alam kung all of us are looking into this, but we advise this, we use this for our patient. I also tell them, diet is based can take our traditional, eating the traditional Asian diet. Katulad ng Vietnam, magulay talaga sila, they are fond of vegetables, more meat. They have lower rates of eating. Who adhere to sufficient variety of traditional food are considered the healthiest. Hopefully, yung Philippines as the healthiest. Fortunately, the way that we see now, younger people, diabetes, hypertension, etc., mukhang hindi nasusunod yung Asian food pyramid. So we have to also inform our families, ourselves, and our clients to stick to have a more diet based on more on vegetables and fruits and less on processed food. Okay? So that's having a balanced diet. Some studies that would really support the evidence on the importance of nutritional intervention on immunity, particularly for respiratory infections. It says here that if your diet is more on vegetables as well, you have faster reduction in the risk of infection and even mortality from various infections. Higher doses of antioxidant vitamins effectively minimize the chances of infection. Vitamin C, vitamin E, vitamin D are very, very helpful for us to really boost the immune system. Probiotics, on the other hand, it enhances our good bacteria in our gut. It could serve as a barrier in the intestinal mucosa, and it could confer adaptive immunity as well. And some strains would show agonistic effects towards host gut microbes. So there is a reduction in the recurrence of ORT and common colds. So there are a lot of studies that would really look into the effects of proper nutritional intervention with regards to improving our immunity. The leading illnesses in the Philippines in 2020 is still infectious. So that would include the upper and lower respiratory infections. And having said this, we have to really, really enhance our immune system through nutritional interventions. Okay? Probiotics in the immune system, as I mentioned a while ago, 70% of the good bacteria or the workforce of the immune system is in the gut. So we have to take care of our gut. So it provides barrier function in the epithelium, the host microbiota, to maintain the symbiosis in our body. And it also shapes immune responses and prime immune system against pathogens. So that's how probiotics would work in our immune system. So not all probiotics are the same. Remember, there are regulations of the host immune responses. So it's dependent on the gene and the strain of the probiotic. They exert different levels of immune regulatory effects. So not all probiotics are the same because they have their own modes of action, the way they are affecting the gene expression, protein synthesis, signaling pathways, etc. Okay? And there are a lot of studies about this. Okay, so diet, nutrition, now we go to exercise. So if I'm going to ask you now, or ask yourself, do you actually do your exercise regularly? You have to. So regular physical activity improves bone health, reduce the risk of hypertension and NCDs, maintains and this is very important, it enhances resistance infection. The recommended minutes per week is still 150 at the minimum. 150 minutes of moderate intensity exercise for every week. And if you can go beyond, that's better. So it's not an excuse, not that. There are a lot of chair exercises, bedroom exercises, 5-minute exercise, 10-minute cardiac exercise, etc., which you can squeeze in your busy schedule. So pwede siyang magawa talaga. Okay? The important thing here is that when you do your exercise, it has to be done on a regular basis. And regular means not once a month. Regular means at least a minimum of 150 minutes of exercise on a weekly basis. Okay, so exercise, inflammation, and infection. What does it do? So if we do exercise, both acute and regular, it could influence our systemic inflammation because the exercise load has a J-shaped relationship, for example, for URT, susceptibility. So for those of you who are exercising, kung mapapansin nyo, less kayo na magkaroon ng infection ng ubot-sipon because you have already the benefits of systemic effects of exercise. So it could be due to increased pro-inflammatory serum cytokine levels. But if you do it on a regular basis, you decrease these pro-inflammatory levels. You could increase anti-inflammatory serum cytokine levels as well. So make it a habit to include exercise as part of your daily routine. A 5-10 minute break doing exercise won't hurt. And it makes your immune system stronger. Okay? Stress management. So this is very important because stress has been linked to a lot of medical conditions, both physical and even mental conditions. So it has created a very meaningful effect in terms of the immune parameters, such as what you see in the slide. And it has an effect for body responses, infections, and inflammatory stress. It would lead to a lot of physical and mental disorders, cardiovascular diseases, diabetes, and even triggers certain cancers. So we need to learn how to manage stress, either by physical activity, present moment awareness, that's what we call mindfulness, leading a balanced life, work-life balance. All work, no play will make you dull. No, yung sabi nga nila. Conflict resolution skills, remove the negativity. No? Journaling, some of us would find it very, very helpful. Yung me time, writing, a reflection, or just painting, writing a song, playing the instrument, dancing, etc. Whatever makes you feel relaxed, just to alleviate stress. Meditation is also very, very important. It could be at the same time when you allot your time to pray. That could be a good time for meditation as well. And of course, time management plays an important role para hindi ka talaga mapapile up kung ano yung gagawin. No? So stress management is very important. I think most of us have found the way to alleviate stress during the pandemic. No? So nabigyan natin ng oras, things that we wanted to do during the pandemic, just to address the stress that we are all feeling at the height of the pandemic. Sleep. So sleep is another factor that needs to be addressed. So we do not just want long hours of sleep. And recommended sleep is around 7 to 9 hours of quality sleep. But if you sleep less than that, as long as it's good quality, meaning nandun ka sa third stage of sleeping, okay yon. Ibig sabihin, when you wake up and you cannot remember what you dreamt about, you had a very good sleep. Okay? So sleep and circadian system are strong regulators of the immune processes. It enhances our adaptive immune response. And based on a study, those participants who regularly slept on the first night after maturukan ng COVID vaccine and 4 weeks later, had a 2-fold increase in antigen-specific titers versus those who did not or stayed awake the night after they were vaccinated. So very important siya. Lack of weakens the immune system. So sleep as a lifestyle approach along with diet, physical activity, benefits overall public health. Okay, so sleep yon. Infection protection. This one, kahit hindi pandemic, we should always be doing this because the World Health Organization recommends always consistently, religiously carrying out mechanisms that would build environments, workplaces, efficiently preventing infection. So hand washing, meron tayong vaccines, meron tayong surveillance, we have activities like this, reiterating the importance of infection protection. Okay? Hand hygiene. Hand hygiene, proven, tested, the single most effective way to prevent the spread of infection, even before the pandemic came. So it could have been the must know mula sa bahay hanggang mag-work tayo, no? So hand washing technique with soap and water, 12 steps. We need to teach our kids, our family members, our clients, our friends on how to do proper hand washing technique. Kaya lang, sometimes I observe sa mga public comfort room, no, parang ginaganon lang yung kamay, tinatapat lang sa gripo, okay na yon. So we need to constantly remind the hand washing technique properly, because it will really help us prevent the spread of infection. And remember, direct transmission, fomite, that's why we wanted to avoid touching contaminated objects or surfaces, especially when we are touching our face, okay? Because we want to prevent transmission of pathogens to our bodies, okay? Hand hygiene. Vaccination. So vaccination is another way to boost our immune system. It reduces the risk of getting a disease by enhancing the body's natural defenses. So yung antibodies yung pinapalakas natin. Immunization helps prevent 3.5 to 5 million deaths every year. So I hope you're vaccinated as well. Critical in the prevention of infection disease outbreaks. Okay? This is an evidence on the impact of vaccination of COVID-19. So unvaccinated patients have higher risk of severe illness, as you can see here. Hospital stay is longer, ICU admission is longer, ventilation is also worse for unvaccinated, and death is higher for those patients who wasn't given COVID-19 vaccine. So makikita talaga natin first-hand experience in the Philippine General Hospital, where we get to admit a lot of COVID-19 patients. Mas pangit yung prognosis talaga. No? Higher number of deaths for those patients we have admitted that were not vaccinated. So lalo na nung nailabas na yung vaccines. No? So it's really very important at that time when we admit patients, automatic yon. We have to get a vaccination status because we have to prepare. When the patient says wala siyang at all na vaccine, then we start to prepare. We have to be vigilant with regards to monitoring this patient because they are the ones who tend to have the severe illness of the COVID-19 infection. Okay? So, another way to prevent the spread of the disease, as well as to increase awareness and to fight antimicrobial resistance, is antimicrobial stewardship. And we all have a very important role to play with regards to this. So we all know that until now, as we speak, the increasing burden of AMR is still out there. So there is still inappropriate utilization of antimicrobials. And this has been a growing global health threat. So we have to do our part. We have to contribute to the awareness regarding this. So how are we going to do that? We all know that of all the core features of antibiotic stewardship, we need to do regular educational intervention among our colleagues, among our clients. Culture reports. We need to of the use of antibiotics and its rational dosing as well. So we still need to promote this because our clients who try to get antibiotics even. And I do laud your group because I know your team has been one of those who are very, very strict. No prescription of antibiotics. So we really need to spread the awareness on that. So what's your role? In terms of medication indicated to boost immune system is there. So either be it you play a very, very role in disease management and prevention. You are part of the healthcare team. You act as a communicator every time you talk to clients and patients and even to doctors whenever necessary. You are a trainer because you want to promote the right information, to give the right information to your non-pharmacist staff. Or even the pharma industries, patient support groups, and even the consumers. So you have a voice in really making our kababayans understand medication, the right dosing, the right use of antibiotics, being an antibiotic steward. And you are a health promoter. You provide advice to help clients, patients, and their families to make informed health choices. So in the advent or in the full implementation of universal health care, you have a very important role in the primary care level. No? So kailangang mapalakas natin yon. We need to provide the right information to improve health literacy among Filipinos. So the role of a pharmacist in infection prevention and antimicrobial stewardship could be summarized into three. Number one is to promote the use of antimicrobial agents. Education are on in infection prevention. So hindi lang natin because that's our work, but rather improve the knowledge of our clients and our colleagues so that we will be able to help in the prevention of infection and in antimicrobial stewardship. Okay? So your role in vaccination is also very important kasi yung promotion of immunization, that's in the supply chain. So that's the logistics. Kasi communication and social mobilization. In the to support our recommendations for health. Okay? So in summary, we've discussed very, very, very briefly, and dami, immunology and immunity to understand how the immune system protects us from illnesses. Alam nyo na yung defenses, the first, the second, third line of defense. The mode of transmission, how disease spreads, and what are the factors or what can we do to fight this? So that's our diet, our exercise, our sleep, stress management, infection protection, and vaccination. And lastly, we talk about your very important role in empowerment of the patients, in educating our clients and consumers to take care of themselves and prevent illnesses. These are my references, and let me end with this, The time for a strong immune system is not yesterday, not in the future, but now. And we do not wait for another pandemic to mind about our bodies. So with that, I end my presentation. Thank you very much.
All right. Thank you very much, Dr. Limpoco, for that very informative lecture I'm pretty sure that I'm speaking on behalf of all of our attendees. We learned so much from you, and probably some of them have some queries that we will be attending at this very moment. All right. To our attendees, we are now down to our live Q&A session with our guest speaker, Dr. Limpoco. If you have any question for her, free to key it in our Q&A section, and we will try to accommodate as many questions as our time will. Right, Doktora, are we good to
Yes.
start na po ba?
Yes, go ahead.
Okay po. Our Doc, why
Yes.
is it important for immunology?
And nga namin eh. Because most of the time, our patients wouldn't go to us agad. 'Di ba? Sometimes or most of the for us to infiltrate immunity the immune system, because we don't know when a client would pop up a question regarding this. And how the right information. Lalo na ngayon, napakaraming info sa social sa inyo, a credible answer coming from you.
All right. Thank you very much, Doc. And if I may add din po, no, I think gone are the days that farm own information about so as ways as to how patients can strengthen their immune system. Right, Doc?
Yes.
Okay po. For
Sir,
another
competently.
question, Doc, more on antimicrobial service.
So, I think you've been doing very good. Number one is, hindi nyo pinapayagan ng antibiotic without the updated prescription. That's number one. Malaking tulong po yun. Our patients would tend to, for example, we prescribe for 1 week. And so 21 pieces. I'm sure not all of 1 pieces. Tama? Some would just buy 5 or 6. And then, they wouldn't finish the 21 pieces. Kasi after 2 or 3 days, okay na sila. So they will keep the prescription. Yun, many pieces yung na-buy. Yun. So, if they just buy 6, may gumaling na siya after 2 days. Hindi na tinapos. 2 months after, meron na naman siya ubusipon. Hindi yan magpapa-check up. Pupunta na lang yung prescription. The best tell them that. So that's one big help for us doctors. That's already collaborating, no, in terms of not allowing them to get that. Number 2 is we have a lot of partnerships with big groups, with big pharma groups na merong hub, patient hub. Meron kaming tinatawag na medical counseling that the pharmacists are the ones who are educating the patients, the clients regarding their medications. That's another collaboration. And number 3, ito siguro baka not all of you are aware pa, ano? Siguro show of hands, how many of you have already actually registered to your consulta provider? Meron na ba? Meron ka bang nakikita, Sir Clark, na nag-raise ng hand? Yung naka-register na sa consulta provider niya?
Parang wala masyado, Doc. Oh.
Okay. So, you need to know kung sino yung consulta provider mo. Actually, it's your choice. Why do I put emphasis on that? Kasi this will be part of the primary care team, primary care level team yan, no? Kung ikaw ay naka-register sa isang primary care provider mo, alam mo kung sino yung kapartner some of the ways that we can work together actually. DPD like this, 'di ba? Ang ganda niya na merong interaction, may discussion, may sharing of experiences. And it's good to know that the president down with the medical societies to discuss ano ba yung mga pwedeng collaboration. So, I guess that's it's been happening already, but ang kailangan natin talaga is widespread of the information. And you are part of that, no? Yung sa prevention aspect na. Yan,
And
Sir Claude.
thank you, Doc. No, and I think we should also thank the doctors as well for giving us the opportunity, for us pharmacists to actively participate din po, no, in improving our patients' antimicrobial therapy. If I may just share, Doc, in my when it comes to suggestions sa mga dosing, and of course dun sa mga information, no, na we share to our patient, especially those who are ordered for discharge. So we
Yeah.
are really grateful for that opportunity po.
Yes.
All right po.
May comment yata.
Ah.
Yeah, oo. Sa province. Oo, no? So baka
Opo.
kailangan nating yes, yes.
Is keto or low carb diet boost immune system?
Well, I would say yes. Marami kasing lumabas na mga, that's part of the diet, diba? Dietary approaches, no? Yung keto diet. But among all the approaches on diet na ginawa ng meta-analysis, what has been shown to have benefits is the Mediterranean diet. So, Mediterranean, so talagang ano pa rin siya, plant-based pa rin talaga siya. That's why, if we plan to do weight management or undergo keto diet, kailangan upon the advice or na-evaluate ka muna ng iyong primary care provider, ng iyong doctor. Because we need to consider not just the immune system but the effects of keto diet on the organs, on the kidney, on the liver, na yung mga ganyan. And sometimes nami-mislook ito, no? So kahit nag-work well sa isang person doesn't mean that it will work well for you. Because remember, yung organ system natin, ano yan, unique yan para sa'yo. You have your own immune response. So, mo siya i-promote. So, is the Mediterranean diet. Yeah.
Yeah,
That's
I think the best thing to do talaga really, Doc, is to consult a professional, no, with regards to before it instead mas Alright. So another controversial question. What is pro vaccination hesitancy when there is major sign?
Okay. So, of tackling, one rule naman sa atin, argue with the client. Alam ko natutunan niyo rin yan. Never argue with the client but acknowledge because that's their personal opinion. For them, that is what is right. So respect that. But it's our obligation or it's our responsibility to give them the right information about it. Hindi naman natin sabihin na mali po yan, dapat ho magpabakuna kayo. But rather, we have to understand or to know ano yung context. Bakit kaya ayaw niya? Baka may past experience siya. Masyadong nasaktan nung tinusukan ng vaccine dati. Hindi niya makalimutan, traumatic yon para sa kanya. Parang gano'n, ano? It's but the experience of baka yun yung traumatic sa kanya. So, to know the context. Second, baka kasi meron siyang kakilala, kaibigan, nakakwentuhan na right after po binakunahan, namatay, Doc. But again, we don't know anong nangyari. Bakit namatay? Baka naman nagkataon na it's not because of the vaccine, but because of a prevailing medical condition. So ito yung mga bagay that we need to probe on for the patient. Siguro ang best approach po niya is tama naman po yung points ninyo. But if you are really po to have yourself vaccinated, baka better po you talk to your doctor about it.
All right, Doc. Okay.
So
Yun,
parati tayong hindi naman next we help the patient start. Can you still hear me?
yes po, Doc. Yes po.
Ayan. Akala ko
Tama.
nawala ako.
If I may add lang din, Doc, no, I think it's another problem siguro, especially in the present times, yung existence ng mga online platforms, which I think somehow gives opportunity for some
Yeah.
people to perform misinformation or disinformation on social media. I wonder, what can we do po as healthcare professionals, Doc, to, really prevent this information, this misinformation and disinformation from harming the patients? In the
Yeah.
physician's perspective po.
So that's a very good question. Yeah. So in my point of view, I get to always encounter my patients coming to the clinic telling me, Doc, narinig ko po kay ganito, na ganito pwede pong inumin or pwede pong namin gawin, etc. The next question I pose to them is, have you checked po yung legitimacy ng information? Because a lot of information in the internet may not be true. No, pwedeng clips lang 'yon ng statement, hindi pala yung buong statement siya, 'di ba? So we put context to that. So I tell them to go to, or I direct them to sites for patient support group na talaga namang may control in terms of ano yung contents. I tell them to go to, ito po yung support group, diabetes. Ito yung website. You can social. So, andun pa rin tayo sa point na kahit sa mga own social forms natin, we share the right information. Hindi dahil gusto nating ma-monetize, but rather advocacy ba natin to give the right information sa kanila. Ayan.
All right, Doc. We have another question here po, no? You mentioned a while
Yes.
ago about our role as pharmacists in antimicrobial clinical diagnosis of younger people with antibiotic resistance already and requires them a higher dose of antimicrobials. How can the Department of Health ensures the AMS will be observed at all times?
Woo! Miss Universe question. Perhaps I'm not in the position to say what is the current state of our country in terms of AMS or the surveillance, because in fairness to the medical organizations in charge of doing that, ginagawa yon. I've been submitting reports to the DOH. Kaya lang centers kasi siya eh. We can't really say na community nationwide siya yung ating database. It's still coming from big centers. So wala talagang big picture or a nationwide picture kung ano ba talaga yung status natin. But I'm sure in our own way, in our organizations, we've been promoting, and we have launched projects targeting AMR and the spread of the advocacy. Siguro, tayo, in our own little way, pwede tayong maging part dun sa education campaign sa mga patients, sa everyday encounters natin sa clients, so that maiiwasan ito. I do agree kasi we get to see minsan patients coming to us na nakita na rin na ang antibiotics nila at the community level, pang hospital level. O, di ba? May ganon. So we need to somehow look at current data. Ito yung part na talagang reporting coming from your end siguro. Ano yung mga most used antibiotics? Kasi tinitingnan natin yung ano niyan yung curve niyan, resistance rates. Ano yung kailangan mo nang wag setting na antibiotic, taas pa ng rates niya. Yung ganyan. So, with regards to the exact data, I don't have. With regards to what DOH is doing, perhaps meron naman. Meron naman. It's just that, siguro, kung nandun lang tayo sa areas natin, hindi natin nakikita yung bigger picture outside. But I'm sure may mga reporting yan parate. Annual reports yan parate.
Yeah. I agree with you, Doc. I think meron din naman po. I think nagkakaroon lang ng problem when it comes to scarcity din ng mga ID specialist natin that
Yes.
can actually serve as a chairman of AMS committee. And at the same time, yung mga educated na clinical pharmacists, no, who can also perform point of care interventions for their patients. If I'm not mistaken po, Doc, 2022 is actually the recommended deadline, no, ng Department of Health for the implementation of the AMS program. But yun,
Yes, agree. So siguro on our end talaga is yung reporting and surveillance Doon tayo pwede makakontribute. So have this body of evidence to show. Diba?
Opo.
Let's see Clark kung baka next year mare-report. Baka sasama sa report.
Hopefully, Doc. Another Doc, I think this is actually my personal question. What can you suggest po for those who are in the healthcare setting na sleep deprived, overwork, and at the same time medyo physically inactive since nasabi niyo nga kanina na very important yung role na yun for our immune system. What can we do actually to improve our immune system, to strengthen ourselves and protect ourselves from communicable diseases?
Okay, siguro the very first step is to check on yourself. Dapat motivated ka that you have to have a healthy lifestyle. Kasi wala yung just, delete mo nakukuha. Hindi mo pipilitin yung sarili have more time to travel and wala akong sakit. Parang that's your motivation. Number 2, sleep deprived. Marami sa atin na ganyan, sleep deprived. Choice. A choice. Bakit ko sinabing it's a choice? Because kahit very work natin, we still need to have our health. So, ibig sabihin, sa gabi, instead of 2-3 muna. Parang, we tend not to, sige, sandali lang to, pero oras na, lumampas na yung oras mo, ang haba na nung dato will have so affected na yung break sa just boost lang. And then aside from the self that your mental health break will come in, your mindfulness will come in, priority life will come in, mga ganyan ba, no? So it's really more on knowing yourself para you can say na kaya mong address ito or ma-boost yung immune system. Yan. Baka ikaw, marami ka pang ma-share na info, but I think being able to manage your stress is an individualized thing. What will work for you? Pero importante, alam mo kung bakit kailangan mo siya.
Apo. And depende rin siguro, doktora, sa stressor mo.
Yes.
Anyway.
Alam mo, patient ko, if you know your stressor, take it out. Take it out. 'Di ba? Kung alam mo, because my stressor is my wife or my husband or my mother-in-law. So, hindi nga naman, hindi mo maaalis. You can just do something about it. Yung mga ganyan ba?
Alright, doc. Question po, vitamins really help boost immune system po, or exercise and healthy food still play the vital role?
Yeah, so very good question. Actually, if you are the right amount of food every day with vegetables that you eat, breakfast, lunch, dinner, and you are assured that you are eating the required daily requirement of all these vitamins, kailangan yung supplement. Kung maa-assure mo, 'di ba? Kung maa-assure mo na makakain mo. Kaya lang, if you cannot assure that you take or you get all the nutrients that you need from the food that you eat, then that's where the role of your multivitamins will come in. Sila yung mag-o-augment doon sa required daily requirement mo for all these vitamins and nutrient supply that you need for the immune system. So yon. Kaya sabi ko, kung ikaw ay may comorbid condition, hypertensive, diabetic, okay lang makalimutan mo yung vitamins, wag lang yung maintenance. So that's where your multivitamins will come.
Right. Thank you, doc. Another question, I think, timely and relevant, no, in the recent years, doktora. We have been experiencing patients taking vitamin C twice daily. Does it really boost the immune system more? And some patients were taking it twice. Some of them developed nephrolithiasis. What can you say about this, doktora?
Clark, tama ba? Medyo nawala ako dun sa part ng eksaktong question mo. Is this
Okay.
taking the vitamin C? Tama ba?
Yes po, doc.
Sige, okay. Yung twice, yung ini-increase yung dose?
Yes po, doc.
Okay. My answer is this. We only need the required number of vitamin C per day. Magugulat kayo kasi hindi nga siya even 500 milligrams. It's even less than 100 milligrams na vitamin C per day yung kailangan natin. If you take double dose, whatever it is na kailangan lang ng body mo, yun lang yung i-absorb niya. And the rest would go out through the urine. So sayang lang, nasayang mo lang. For those who are high risk to form stones, dito nagkakaroon ng higher risk. I'm not an advocate of ubot sipon eh. Hindi eh. Hindi ganun. So yung ating iniinom, composition po ng multivitamins is just enough for lang talaga siya. Excess na iniinom mo, it's kumbaga added cost pa rin.
Alright. That's noted po, doc. Another timely question po. What can you say about people not wearing face masks?
Ayan. Kasi it has been lifted na. Choice niya kasi yun na hindi siya mag-wear ng mask. Pero you wanted to wear it because you want to protect yourself. So, still a choice. Hindi naman natin pwedeng awayin kung ayaw niyang mag-mask, no? Kasi pwede talagang niyang i-quote na it has been lifted. You, para sa'yo, ako, I still remind my family, my patients to always wear it, lalo na in crowded areas because COVID is there. causes of respiratory disease is still out there. TB is still out there. Hindi pa natin na papababa ang TB cases talaga natin. So, talagang choice na lang kung protektahan yung sarili. So, kung ikaw naman, symptomatic ka na, then it's also your responsibility not to report to work anymore. Mag-self-isolate ka na para hindi mo na rin maipasa yung
even though he or she has completed his or her antimicrobial regimen. Like, for example, every time I have a cough, the doctor would give me azithromycin. And each time na nagko-complete ko naman, in the future, may possibility po ba na di na mag-e-effect ang azithromycin sa akin?
Well, resistance happens when we give the same antibiotics too soon after finishing its complete course. Ibig sabihin, in less than a month. Yeah, this you give the same course of antibiotics, pwede kang mag-develop ng resistance. But remember, yung causes na
Hello, Doc?
azithromycin, as long as it has been given na spaced out talaga siya. Isabihin natin na ibigay. Given every month nagkakaubot-sipon, parang gano'n, no? So baka virus lang yon, baka hindi mo nga kailangan ng antibiotics, diba? So it's really very important na ma-assess talaga ng doctor. So in practice, what we usually do is not to give the same antibiotic too soon.
Okay po.
So pwedeng 2-3 months apart space. At tinatanong ko yan, kailan ho yung huling antibiotic na inom ninyo at ano po yun? So that I know if I need to give another class, another group of antibiotics, or I could, or it's safe to give the same antibiotic.
Okay. Saka very important talaga na we use antibiotics rationally, no, Doc? Hindi nagse-self-medicate. Siyempre
Agree.
pharmacist, We have the access. We have the access. We don't need prescriptions if we want to, no? But again, we have to go back to the fact na if we really want to prevent ourselves from developing this kind of problem, which is antimicrobial resistance, we have to be disciplined. And we really have to make sure na we're taking these medications rationally. Tama po, Doc?
Yes.
Okay po.
Agree.
Another question po, regarding lang sa vaccine. I was vaccinated 3 doses of Sinovac and wala pa po akong 4th dose. Is it okay that I will be given a bivalent COVID vaccine?
Yes. Yes, pwede po. Actually, kami nga sa hospital, parang 3 klaseng vaccine na ho yung naibigay sa amin. No? But yes, pwede po. Hindi naman po siya contraindication because what we're after is the antibodies naman.
Malinaw na po 'yan ha. Ang vaccine ay mahalaga pa din, no, kahit na medyo nagla-lie-low na yung ating number of cases ng COVID-19.
It's the same
Alright.
with the flu vaccine, di ba? Yearly
Opo.
nga dapat may flu vaccine tayo.
Hindi pa rin hindi pa rin tayo pwedeng maging relax, Doc, tama?
Yes,
Okay
agree.
po. Another question po. Doc, when to recommend probiotic supplements? Is it before, after antibiotics? And is it disease, for example?
Sir Clark.
Okay po. Probiotic supplement during or after taking antibiotics? And is it advisable to give probiotics to patients with Crohn's disease?
Okay, so the thing with probiotics. So usually we give it not at the same time sa pag-inom ng antibiotic. Why? Siyempre, no? So wala, parang pinatay mo rin siya pag tinake mo siya at the same time with antibiotics. So we give it separately in between the take of antibiotics. In practice, what I usually do is I usually start the probiotics after finishing the full course of the antibiotic. I give it for like 1 to 2 weeks after the intake of antibiotics. But sometimes when a patient starts to take it even before going to me, ibig sabihin nasimulan na niya yung probiotic, pinapa-continue ko lang yun sa kanya. But with the advice of taking it in between the intake of antibiotics, kung kailangan ko siyang i-antibiotic. So, for example, yung antibiotics na, she takes it after breakfast, after lunch, after dinner. The probiotic, I advise her to take it AM snacks and afternoon snacks or at bedtime para hindi siya kasabay ng antibiotic. With regards to Crohn's disease or other diseases concerning the gut, it could be given. There are strains that are specific for such conditions, but upon the advice of your doctor. So, parating nandun pa rin, ano? So, hindi pa rin natin ina-advocate na porket probiotic, over the counter siya. Dapat, it should still be upon the recommendation of your doctor.
Okay, Doc. We have another interesting question to ulit. Ang dami nating questions, Doc, no?
Sige.
Ang dami
Sige
nating
lang.
questions.
Yes.
So, do you recommend taking magnesium for anxiety disorders?
Okay. I still go by the evidence pa rin. Unang-una, I need to establish anong type ng mental disorder. Kasi may medications naman talaga for the mental disorders na. If taking of magnesium, because magnesium plays a role in terms of cognitive function, memory, and
Have learned so much, just like me. Again, thank you very much po for answering our attendees' queries.
yeah, baka may part 2 ito just to answer the questions. I wouldn't mind.
Sana po, sana po. All right.
Thank you very much.
Thank you,
Clark.
Doc. Thank you po.
Thank you.
All right. To our attendees, appearing on your screen is our QR code for the evaluation form for this event. Each participants will finish this evaluation form so that you can receive your CPD certificates. Don't forget po, we have evaluation form for this event. Stick kayo sa amin minutes para maging legible kayo for an CPD certificate. Thank you very much to all of our attendees. I hope that you learned something from Dr. Limpoco's presentation, just like I did. This has been your moderator, Mark Laidoana, saying thank you. Stay safe and see you again on the next Wipe RX events. Thank you po.
Swipe RX.